and welcome to this Communities for Immunity event, which is being brought to you by the Public Library of Mount Vernon and Knox County. We are really excited to be here today. My name is Jamie Lynn Smith-Fletcher, and I'm the grants administrator for the Communities for Immunity project, which helps to counter misinformation and promote COVID-19 vaccination in response to the ongoing pandemic. And I'm here with our project intern, Shauna Walsh, who will wave to you all the way from Connecticut, and then with Heidi Peterson, our special guest today. Heidi is a nurse, and she's been involved in responding to and working with patients all during the pandemic. And so I thought it would be really interesting today to hear from her and hear about her experience. One of the things that I think we kind of forget sometimes is that we are walking through history and that we're living in it all the time. Before the COVID-19 pandemic, in fact, my husband and I found a box of letters from his grandmother and grandfather before they were married, and they were kind of like, it was I guess sort of like the 19 whatever version of DMing, right? So they're writing these letters to each other while they're courting. And she was a nurse during the 1918 influenza epidemic. And so she wrote about her experience. And it was really interesting to see and hear that. And so I thought we would bring Heidi here today to talk about her own experience. So welcome, Heidi. Can you tell us a little bit about your background?
Sure. Thanks, Jamie. So I am a registered nurse with my master's in nursing. During my master's program, pre-COVID, I actually wrote about vaccines and how they work and how they affect communities and population. I also am a board certified national healthcare disaster professional. And I am a member of the Ohio Military Reserve, and I work in a medical capacity in that. So I have spent about 6 of the last 12 months on active duty, supporting COVID missions hand in hand with the Air and Army Reserves, the National Guard, in a variety of capacities.
Oh my gosh. Okay. What do they have you doing? I have like a regular desk job. So this is fascinating to me.
So
and I'm also really thankful for your service.
Oh, thank you. So we have done a number of different missions. Some of our missions early on in the pandemic were to provide staffing support in nursing facilities. As we know, the COVID infection in our elderly was really rampant especially in the beginning, and very detrimental to far too many of them. And with it passing so quickly in those type of settings, when you have congregate care and people living in close quarters, it spreads pretty quickly. And that also included the staff. And a lot of nursing facilities would find themselves unable to keep up with staffing and unable to meet safe staff to patient ratios because they would have so many staff out with COVID, and they would be out for 2-3 weeks at a time. So we would go in and we would provide support to these facilities so that the needs of the residents could be met with minimal disruptions to their normal routines. We also have set up and staffed COVID testing sites so that people could, get tested in a much quicker fashion. Also setting up sites at some of the nursing facilities where, they were having to test 2 and 3 times a week in order to make sure that they were not bringing the infection into the facility and impacting the residents there. In addition, we have done COVID vaccine missions. And we have gone out to some of the senior living centers, a lot of these being in low socioeconomic areas, for people who could not get outside of their building that they lived in to get the vaccine in other fashions. So we have done a lot of different supports for COVID. Some of my counterparts who are not clinical have staffed jails in the state of Ohio. They have worked for the unemployment offices to help get through the backlog of cases that came in when a lot of places had to shut down and make sure that people were getting their unemployment. So as a whole, we have supported a lot of different missions all related to COVID.
It's been such a hard time for people with the pandemic that sometimes I'll think back to the early days and realize, oh my goodness, I forgot about that, or I forgot about this, and also because we're heading into the third year, everybody has like a little bit of fatigue and stuff. And I think with your perspective in emergency services and as a nurse, I guess my next question for you is kind of like, we know that there are one of the reasons the library got involved with this work is that we know that there's a lot of misinformation. A lot of it's online. Some of it, though, is just regular word of mouth. It's not like the internet invented gossip, although it feels like it was invented for it. But it certainly spreads, and misinformation spreads in lots of different ways. Like if you had anything, let's say you had like 2 minutes in an elevator with someone who was skeptical about the vaccine after administering, I don't know how many doses of it yourself and, yourself being vaccinated, like what would you want them to know, about your experience and about the science?
One of the things that I would point out to them is that, if you look at the Johnson & Johnson vaccine or the Janssen vaccine, a lot of people were really drawn to that because in the beginning it was one shot, one dose and you're done, one and done. I heard it, a lot. And on the front lines, we did see, a few more side effects immediately. I mean, just mainly people getting lightheaded and having some dizziness. But all it took for the FDA to put a pause on that for more information was 6 solidified adverse reactions. It took 6 out of thousands upon thousands doses administered. There were 6 adverse reactions that were truly linked to the vaccine. And the FDA said, whoa, we have to stop so that we can look into this more. So if there had been, hundreds of people dying from the vaccine or, hundreds of people having serious side effects from the vaccine, the FDA would have stopped. They would have said, whoa, we need to stop and we need to relook at this because that's what they do. And they didn't do that with the other vaccines because they were not seeing that. And they did eventually put the Johnson & Johnson back on, but with additional warnings, especially for people that fell within that demographic that they were seeing those reactions in, because they wanted to make sure that people truly had the information they needed. And I think that is one of the big things, if I had to really narrow it down to a short time frame, that I would point out to somebody. Had there truly been all of these serious adverse reactions, the FDA would have paused the vaccine to figure out what was going on.
Certainly. And, that's a tactic that I often use when I'm engaging with people as well, because even if the FDA didn't pull it, or somebody who thinks that the FDA is somehow embroiled in a conspiracy as well, right? Like, and have a mistrust of institutions, like even if it were that far reaching, so many people have been vaccinated, right? I think we're at over 28,000 in Knox County alone. Right. The hospital would be teeming with vaccinated people who have complications rather than full of unvaccinated individuals on respirators and who are fighting for their lives. So, I appreciate that extra insight. I didn't realize it was only 6 cases with Johnson & Johnson. So if that's all it took out of millions of doses to pull them off the market for a while, then I feel even better. Shauna, did you have a question for Heidi?
What would your advice be to someone who's gotten their vaccine but is nervous about receiving a booster?
So I would say that, here, the last 2 months, January, February of this year, I spent a lot of time giving booster doses of the vaccine. And I can tell you that I have not met anybody who has had anything more than, the general typical sore arm from getting that you would get with, most vaccines. Your muscle doesn't like getting, that needle put in it. So it kind of gets a little sore. But outside of that soreness of the arm, that's the only thing that I have seen that has been any type of reaction from the booster. And there are multiple studies that show that the amount of immunity that you get really does go, it skyrockets. It goes through the roof when you get that booster dose. So you are truly providing yourself with a lot of extra protection.
Thank you. That is also really good to know. Now that we've kind of talked a little bit about the facts of the vaccine, going into your own experience, we looked at, like I said, we looked at some family letters that were 100 years old, so in 100 years, this may be too big a question, but like in 100 years, what would you want your, oh man, I always forget this word, not forebears, your descendants to know about this time or about your experience during this time? Is there a particular story that's emblematic for you about your experience, as a nurse during this pandemic, or a couple of anecdotes, of course, how shall we say it? Respecting patient privacy. But like what stands out in your mind is like the big thing that you won't forget?
I think that one of the big things I would want for my descendants to know is just that, I did everything that I could as an individual, as a nurse, to promote appropriate and correct information and to protect myself, my friends, my family, and my community to the best of my ability. I think one of the things that really stands out to me was at one of the senior living facilities, there was a gentleman whose aide brought him down, and he was hesitant. He came down with her, and they were giving away gift cards for people who got vaccinated that day. But he still was really, really hesitant, and he was very nervous about the vaccine. And this was a man of color who, because of some things that have happened with people of color in the past, was not very trusting of, medical things that were considered, experimental in his mind, because it was at that point in time, it was emergency use. He was like, to him, that was experimental. So he was hesitant. And I sat down with him and just had a conversation. I told him that I respected his right to choose, which was huge for him because everybody that he had talked to had just been like, you're wrong, and just trying to force their beliefs upon him. And I think one of the things that people need to hear is that I do understand that you have a right to choose, but you are not free from the choices of your consequence. And that is what I talked with him about. I talked with him about potential consequences of his choice. He was older. He had some other health conditions that he needed to take into consideration that made him much higher risk. He had some young people in his life who, at that point in time, the vaccine was not approved for any of them. So him not being vaccinated also could potentially negatively impact them. We talked about his goals and, what he wanted to do. And he had been through some things and survived some things. And, and I just asked him, I said, with everything you have been through in your life, with everything that you have had to see, do you really want to let this be the thing that potentially causes you to not be here anymore and to not be with your family and see, the young people in your life grow up? And that really resonated with him. And he did end up choosing to get his vaccine that day. And when we went back to that site 4 weeks later to do the second dose, he came down and he expressed a lot of thanks to me for being respectful of him and talking to him as a person and not judging him because he was hesitant, but explaining to him that I respect your right to choose, but these are the consequences of making the choice not to be vaccinated. And like I said, that really resonated with him. And that situation really resonated with me because, not only does that protect him, but it protects those around him and helps protect that community that much more.
Yeah, I think that those respectful conversations are what we've really hope we've been able to do, with our programming at the library. It's important to remember, to respect people's bodily autonomy. I mean, that's like just such a tenet of human rights, right? And with that too, if there's anything that I can do to help people around me, I'm always a sucker for something that like has benefits beyond like my own self-interest and stuff. And so I can certainly see how wanting to see, your grandchildren or your children grow up and what happens with their lives would be, a great motivator for him. But do you have any tips or thoughts for, let's say, speaking purely theoretically, people who are still remaining vaccine hesitant or skeptical? One of the things that has been worrisome for me during the pandemic and that I've noticed is that a lot, misinformation is like death. It's no respecter of persons, right? Like you can be brilliant, famous, whatever, and you can still be quite wrong about certain things if you don't have good information or access to it. So I think a lot about the posts that I see on social media from people that are healthcare providers in our community, or first responders who are skeptical, who maybe have even had COVID and made it through it, and who still remain unvaccinated. Like, what would you have to say, about that, or to them rather?
Yeah, I really, I tell people, I'm thankful. I'm thankful that you made it through it. I'm thankful that you, that COVID didn't put you in ICU and on a respirator. While I have not worked in the ICU, I have some very good friends who have. And, most of these people who end up on a respirator, they are asking for the vaccine. It's too late, but they realize like, this could have changed things. It's like, if you hear people, they talk about people who jumped off the Bay Bridge and some survived, and they say as soon as they jump, they regret it. And it's that same type of thing. Like you think I'm invincible, I'm young, I'm healthy, or, well, it's just a flu, or, all of these things that you hear, but you never know if you're going to be the one. Unfortunately, COVID has killed kids. COVID has killed people in their teens, their 20s, their 30s, their 40s, and on up. And you can't guarantee that if you get it, that's not going to happen to you. And then you have the long-term effects from COVID. The long-term effects from COVID are so real. There are people who have not gotten their sense of taste or smell back in a year or two. There are people who have a hard time getting out of bed. There are people who cannot go back to work and who are going to be permanently disabled from COVID. There's somebody that I personally know who got COVID, ended up on steroids to help get over the COVID, got over COVID, ended up with the rebound pneumonia, which is very common to happen after a COVID infection. It needed steroids to get over the pneumonia. And because this person had two rounds of high dose steroids, they ended up in steroid induced psychosis and ended up having to stay in a behavioral health facility. And they are now on medications to help with their mood and their mental health for the rest of their life. Now, is it possible they could have ended up needing some of those meds anyways? Yes, absolutely, that is possible. But steroid-induced psychosis is real. And now this is something that they have to deal with for the rest of their life. In the big scheme of things, they're alive, they're working, they're doing things. But this is something that they may not have had to deal with had it not been for them contracting COVID. And so saying, well, I got COVID and I lived, okay, that's fine. But what do your lungs look like? Are you going to end up with COPD at 50? Are you going to end up, with lung cancer at 55? All of these things that because COVID damages your lungs, you may think that you kind of skated, but you may not have really. And that is something that you truly have to take into consideration because, from the vaccine, vaccines do not have long-term side effects. When you get a vaccine, if you are going to have a side effect from that vaccine, it is going to happen within 6 to 8 weeks. After 6 to 8 weeks, because the vaccine does not remain in your body. It tells your body what to do, and then it is absorbed and it is gone. So there's no such thing as a long-term side effect. Now, yes, there are extremely rare instances where you can have a reaction right after getting the vaccine, and that reaction may last longer, but you're not going to just randomly have a reaction to a vaccine 6 months after you got it. Whereas with the COVID infection, because you have damaged your lungs, you could have consequences of that 6 months, 6 years, 15 years down the road. And that is something that is very, very true that can happen. So that is where, you have to be cognizant of that. You have to be aware of that. The vaccine is not killing people. COVID is.
And what you're saying is resonating with me so much. I'm from Knox County, but I spent the first part of my career in New York. And of course, the pandemic, hit there really hard first, right? So pre-vaccine, tons and tons and tons of people that I knew, friends, family members, former coworkers, people in my social circle died. And the people who did survive a lot of the time talked about the brain fog from long COVID, maybe like you're physically feeling better, but that brain fog was so frightening to me. And of course, when I got my COVID shot and had a reaction, I felt really spacey, and I thought like, gosh, this was frustrating for me for like the 2 days maybe that I had a little fever and mild side effects from the vaccine. I could not imagine making it through an illness that took so much out of you, and I had just such a tiny, tiny impact on my well-being in my life and for such a short period of time. So these long-term effects, of course, this is a new disease and we don't have the data. Again, we're walking through history. The data is coming in now. Doctors are only beginning to understand those trends. And so I really appreciate the light that you've shed on this today, because it's really, really insightful. And it's just so powerful to hear someone speak who's been working directly with people during the pandemic and with these vaccination projects that are saving lives and improving public health for all of us. So Heidi, I just really, really appreciate all of your work. And Shauna, did you have another question or anything before we wrap? I think we've got time for one more.
What do you think about the consequences of working in this pandemic?
I really think that it is super important for people who are working during the pandemic to protect themselves, and not only protect themselves, but to protect those around them. Our frontline workers, more police officers have been killed by COVID than in the line of duty. I think, according to the Firefighter Association, I think it was like 44% of firefighter deaths last year were due to COVID. And those are our very, very frontline workers right there. They are responding to anything going on. And, it's really scary to think about having people out there on the front lines not wanting to protect themselves. But then also I think about, so you have, an EMT crew that goes out to a call. This person is sick. They're going to transport this person in the back of an ambulance, very small, closed in quarters. depending upon that person's needs, that person may not be able to be wearing a mask, like depending upon what's going on with them. And then, you have these close quarters with these, medics that are providing treatment. And, if these medics contract COVID from that person, it's not just them. They take that back to the firehouse. They can potentially infect others in the firehouse, and they take that home. Do they have young kids or elderly parents or people whose immune systems are compromised that they could take that back to? And so it's not just about them surviving it, but those around them that they could potentially take it to. And that's why I think it is so important for those who are working to not only protect themselves, but protect their friends, their families, and their communities.
COVID was the leading cause of death among law enforcement officers as well, because if the fire department is busy, sometimes, police and sheriffs will respond, to a call, to a distress call to try to help someone. And it's such a great risk. So, I hope that we are able to kind of demystify some of the talk and work around the vaccine. And Heidi, I just really appreciate you being here with us today. And Shauna, thank you for coordinating this interview. Any closing thoughts from either of you?
So I will say one of the, and I'll make it quick, an analogy that I have used, which has seemed to resonate with people, is I have 2 bowls with 100 pieces of candy in each bowl. And in one bowl, there are 20 pieces of candy that could make you sick. And of those 20 pieces, that sickness could be anywhere from a cold to death. So anywhere along that range. And in the other bowl, there are 5 pieces of candy that could make you sick. And those sicknesses are a mild cold to maybe more significant cold, flu type symptoms, but none of them will kill you. You have to pick a piece of candy from one of the 2 bowls. No choice. You have to pick from one of the 2 bowls. Which bowl are you going to choose? And the bowl with the 20 pieces and the pieces that can kill you is being unvaccinated. And the other bowl is being vaccinated. And pretty much everybody is going to choose from the bowl that doesn't have any pieces that could kill you. And if that's what you would choose, then you would be choosing to be vaccinated. So that's what the vaccine is all about.
Thank you so much. Shauna, thanks for being here to help run the show for the public library and for all of your hard work on Communities for Immunity. We want to make sure and thank our sponsors there. It has been really wonderful to be able to spend time with community members like Heidi and our wonderful vaccine ambassadors and our health department and other community partners that we have in this project to help spread the word and get some good information out there. So if you want to know more about Communities for Immunity, please visit our website, www.knox.net. And we do have an event on Wednesday, March 9th at the main library in Mount Vernon, 201 North Mulberry Street from 6:30 to 7:30. And it is called Do Your Own Research. And our reference librarians will be there talking to you about how to, in fact, do your own research. And they know all of the great tricks because they are reference librarians. So they're very good at helping you discern credible information, particularly about health. And we will also have a guest speaker that night who's a public health administrator and nurse to kind of cover some of the more medical side of things. But if you are someone who wants to know more about how to find out more about the things that Heidi is saying, or maybe something you overheard at work by the water cooler or saw on the internet somewhere, come to this. It's an hour and you'll leave with skills that will help you determine credible information, whether it's somebody trying to, tell you your warranty's expired on your vehicle and they need your bank account number, or whether it's Social Security fraud, or, the prince in some nation somewhere who just has to give you $5 million, but you have to send him $6 million first. All of those scams that we're all familiar with, they will help you figure out how do I know if this is real or not? Is this information, from a source that is reliable? And how do I drill down and figure out, and make better decisions once I've been informed about all of my choices? So again, thank you, Heidi, for being with us and for sharing so many of your gifts and your experience with us. And on behalf of the Public Library of Mount Vernon and Knox County, thanks everybody, and we'll see you soon.
Yes,
Bye.
thank you.